You can expect your surgery to take anywhere from 1 to 5 hours, depending on the complexity of the surgery. Your family will receive periodic updates on your condition throughout the procedure.
Immediately after your surgery, you will either go directly to the surgical intensive care unit or to the post-anesthesia care unit. It generally takes 2 to 3 hours before a patient kind of wakes up and, feels good and is over the anesthesia. I know you're a little groggy. Everything went fine. Surgery went very well, okay? We got the tumors out completely. You will stay here for approximately 1 to 3 hours for close observation. You will then be transferred to your room.
Hi, Mike. It's Dr. DeCamp. You're in the recovery room. Everything went great.
Your surgical team will be closely monitoring your recovery and working with you to decrease the risks of possible complications. You will be hooked up to many wires and tubes. These include IV lines, chest tube, bladder catheter, oxygen and heart rate, and breathing monitoring.
Your surgeon or a member of his staff will speak with your family to update them on your condition.
So Mike's doing great. I just saw him in the recovery room. Everything went fine. We accomplished everything we needed to do.
After your surgery, you will likely be very sleepy and not remember much about the day. As soon as you are ready and you've been transferred from the post-anesthesia care unit, your family may visit you in your room.
Well, it's, you're obviously in some discomfort, but nothing that I didn't expect.
That first day, the changes hour by hour are quite dramatic.
And you slowly seem to recover, just get stronger and stronger. I'm tired. I'm really tired. So, that's the main thing. I'm tired and you're weak. Yeah, for 15 hours after surgery, I'm not doing too bad.
So the first thing you'll see that Mike is hooked to the oxygen.
Yes.
All right, and that's just given low flow oxygen. And as he starts waking up more and usually deep breathing, then that usually can come off, okay? And this right here on his finger is where we're monitoring his oxygen saturation.
Okay.
And this is the heart monitor to measure your heart rate and the rhythm.
He's also hooked to the EKG, so we're monitoring his heart rate and his breathing rate. If Mike lets you know at any point in time that his heart feels like it's racing, just let us know, and he can be given medication and we can take care of that, okay? All right. And then also, right on that side, you'll see that Mike has a Foley bag in.
Yes.
Okay, and that's to drain his urine, okay? There's a catheter in his bladder. And as he, again, wakes up, starts moving, that catheter will be removed, and then we'll encourage him to start drinking.
Okay.
And he should have no problems going to the bathroom. On occasion, older men, sometimes they feel like their bladder is full, but they're not able to go. They have urinary retention. If that happens, just, again, let the nursing staff know, and we can give them some medication to help with that.
Okay, great.
Okay. The other thing that you'll see right down there is the chest tube. Okay, and that is draining the fluid from around his lungs, okay, where he had the operation, as well as your surgeon taught you a little bit about an air leak. The air is also coming out of that same tube. All right, and once that drainage decreases and his lung expands and he has no further air leak, then we'll also have that chest tube removed.
Blood clots can occur because of lying still, during, and after surgery.
It takes a little bit of time, and these go on your legs.
You will have special stockings placed on your legs right before your operation to prevent blood clots.
When you're not moving, it's important to have those on your legs.
Medications may also be given to prevent clots.
Mike, I'm here to give you your heparin. And that's a medication that decreases the risk of you getting any blood clots.
Sometimes these are given in the abdomen and may cause black and blue spots to appear on the belly. Don't be alarmed if this happens. It is common.
So let me...
We're gonna try to walk down to the end of this hall here, okay?
Getting up and walking as often as possible, like 3 to 4 times a day, will also help.
Put this back on.
After surgery, your team will monitor you for any signs of pneumonia, which is an infection in your lungs.
You'll also notice that we have Mike sitting upright. We talked a lot about preventing pneumonia while he's here in the hospital. So the head of the bed is usually kept up at least 30 degrees, all right? And then he has his incentive spirometer there, which I know he was using beforehand, right? And while he's awake, we're gonna encourage him to keep using that like every hour while he's awake. And then I also see that you have his toothbrush and toothpaste and mouthwash here. And you're right, we want to try and decrease the bacteria that's in his mouth, and so just having him brush his teeth, clean out his mouth twice a day is a good thing as well. Walking 3 times a day.
After surgery, you may become confused. The confusion can range from mild memory loss and anxiety to fear, hallucinations, and on occasions combative behavior. Sometimes the behavior can be worse at night.
Should such symptoms occur, the understandings of family and friends is invaluable. Those close to you are encouraged to work with the healthcare team to provide you with a calm, familiar, and reassuring environment.